female therapist and the client happens to be female, they've been sued as well. And so it really is an issue that we need to be, at least where we are, we have to be very, very careful. And no matter how you set it up, to say, this is a professional situation, and do you feel okay about touching and so on. Most of us still would choose not to unless they're children, and even then you start to get into trouble with problems afterward, the child saying things have happened to them.
How do you get around that and take us to body?
Yes, I think that it depends how we touch, because it's touching, sexual touching, it's touching, professional touching. And the patient can feel this touching very well, I think.
I think that's true. I would agree with that totally, but I don't think most of my clients, I guess I'm saying that I wouldn't trust most of my clients to make the distinction as clearly as I do, just because it is such a problem in our country. We're sued all the time. And unless somebody else was there observing, you know, if you have an observer in the room, that may be okay. On a one-to-one in a private office, it's something I think most of us would be pretty leery about. I think it's also a little different in terms of dentistry, where you're, especially if you're the dentist and you're going to be doing procedures as well, that people expect to be touched.
Well, they expect to be touched in a very specific way,
Right.
and not in another way.
Right.
You have really to tell them when you ask them.
Intentionally touching in a given way.
I guess what we're saying is you really need to understand the culture within which you're using it, which of course is true for any of us, and what you feel most comfortable with, and what your clients say they feel comfortable with. And then you have to look at what your malpractice premiums are like, if it's our country.
Any other questions?
Yes. How long usually is your session? The time, yes.
10 or 15 minutes.
10-15 minutes.
You mean that just the
Individual.
transduction?
Well,
Yes.
the session, the whole, it's a 45-minute office appointment, and then we use the trans state twice in each session. After the dress rehearsal, on the next appointment, we induce the state early after we've inquired about how they've done in their practice. Then we induce it, discuss that experience, and do it a second time. And we advise people when they're practicing alone as well. If they don't achieve all they want the first time, they have two options. They can either continue it, or they can stop it and then do it again. And frequently, the first experience serves as kind of a preface for a more complete relaxation on the second go-round.
In the case that your patient after first session, you say, I was not in hypnotic state. What do you say?
We tell them the things we just told you, that we saw evidence of it. And we also tell them the altered state of consciousness is not a long ways from this unaltered state that we're in right now. And that maybe their expectations were in error, and we try to point out to them if they had an eyelid flutter, if they had decreased respirations, if they had a paresthesia. Those things occur in the altered state, and those are prima facie evidence of the condition. Occasionally you get someone who will be sort of hard-nosed and insist anyway. And we tell them, well, as long as you get the clinical result you're seeking, how you get there and what you call it doesn't matter to us. But it doesn't.
But in general, people in the United States are good informed about hypnosis.
Pretty well. It's
Yes,
getting
the
better than
majority.
it was. Years ago, there still is a lot of stigma about it sometimes. But that's true of anything in psychotherapy in our country. When I first began medicine, I won't tell you how long ago, a long time ago, then it was difficult to refer somebody for psychotherapy, and hypnosis was pretty much unheard of. But within the last 20 years, it's come all the way around until it's quite acceptable now. Even rather fashionable in places where if you don't have a therapist or you don't have a hypnotherapist, then you're nowhere. You're not among the elite. Kind of thing.
I think that the first session, as we talked about, we usually do 4 as an initial package. And the first session, we do spend as long as we think necessary to disarm as many of those fears as possible about the trance. And then when we do our dress rehearsal, as I said, if they don't have any reaction, hey, that's fine, no problem. On the second visit, if they don't, they're still saying, I don't think I've been hypnotized, they don't have any of the signs or symptoms, we go through it all. A lot of times that doesn't happen because we usually set it up when we talk about the misconceptions about hypnosis. One of the things that I usually say to people is that almost anybody can be hypnotized. It seems as though almost everybody has within them the ability to do that. Some people do it more quickly and easily than others, but almost anybody can. And then I'll say something, people who are probably average or above in intelligence tend to do it better and faster. That's sort of an incentive to get people to do it. I'll say people who are slower can learn it, it just may take them longer. And the other thing is sometimes it's important if people are just saying, I can't get into it at all, you can just ask them why they think they're not able to mobilize an ability that they have inside themselves, and sort of put it back on them to explain to you why they're not doing it well. Sometimes it's a matter of changing the trance induction. The one that we just went through here is what we call our generic one. It's the one we use with everybody first. And if they don't like it, if they've had other forms of relaxation training, we might include things like idyllic imagery, where we describe, as he said, the beautiful lake and the water and the clouds. We might incorporate the progressive relaxation, start at the toes and work the way up through the body. So we'll also work with the person to see if there are other techniques that will be more useful to them. Sometimes it's a matter that why they came to see you, they really don't want to do. A smoker who really doesn't want to quit, but whose doctor has said you must quit, maybe after 2 or 3 sessions says, you know, I can do this relaxing, but I don't want to quit smoking. Well, they're wasting their time and money then.
Do you think that relaxation is essential or generic to hypnosis? I mean,
That's a good question.
It's a rather leading question, of course.
Yes.
Actually, I don't at all. I mean,
Yeah.
often I use trance without any kind of, I mean, that even if people are quite tense and so on, it's quite fine.
Yeah. I
Use
think,
it for yourself, you mean?
no, with patients.
Well,
Well, for
patients.
myself,
Yeah.
I mean, I more think of things like utmost concentration and mental imagery and things like that. Relaxation.
I think that those things happen in a state, and usually I associate that state with relaxation, but I believe that that you're right. Suggestion is not necessarily, they're not one and the same. I think there's a lot of overlap, and it seems to me the people with whom I work who I think get the best results probably do have some sort of relaxation associated with it, but I don't think it is essential. But you might disagree.
I agree with you. There's nothing there.
We're thinking,
Some of the hugest trances I've ever seen are done with the African like drums.
right,
It doesn't go with relaxation whatsoever.
Drums?
Drums,
Right.
like in voodoo trances.
Right.
Where the
And
people-
It
can
goes
you-
with,
can
it
you
does
speak
go
up?
with rhythmicity though.
It goes with a huge dancing. And
right,
the drums and the people, you see that because they are trained to go into trance like this, when their own music of their own spirit comes up, and then you see the sweat is jumping out of their face, and they can't move the same way they used to, but they do.
In a very rhythmical manner.
In a strange, different way. Some things like this they do. This is the language also they learn to use to communicate. Like this they can communicate things. The talking is not what, that's how it goes. But it's not relaxed.
No, that certainly isn't.
It is an altered but non-relaxed state.
Very
That's also true in South America. We've seen some of the candomblé, the dances in South America where they do the same thing. And you see the nice eyelid flutter reflex among them after they've been playing their drums. And guess it is an altered state, and,
Well, you know, athletes will do, for instance, you may recall during the Olympics in 1980, they had a massive Russian man who lifted the most weight that anyone's ever lifted.
I can't think
I
of his name.
I can't think of his name now, but on television, you can observe him very closely, and weightlifters do what they call, they psych themselves up, they say. They get down ready to lift, they hesitate, they psych themselves up, and then they lift. The weightlifters I've talked to say that if they lift raw, as they call it, just try to lug it up there, they often injure themselves. So they lift in the altered state, because then they can mobilize greater muscle power. The eyelid flutter that we're describing was perfectly visible on that Russian as he was doing his horrendous lift. And I thought that vindicated everything I'd ever learned about hypnosis. But here's obviously something that's not very relaxed, and yet it is a use of the trained state. There are lots of anecdotes written in many magazines. For instance, I remember one that was in our magazine, Coronet magazine, described a tough black man who stopped his car beside a burning automobile along the road. He looked inside and saw a woman and child in there. Summoning strength that he couldn't even imagine, he wrenched the door off the car and rescued the two people inside. We'll kind of find out he lost his wife and a child in a similar thing some years before, but this is where you can galvanize and mobilize that strength for a useful purpose. We see the tricks they do on the stage where they take a 300-pound man and hang him from the nape of his neck to his heels, and then two other people sit on him. This would be a task he couldn't possibly perform except when he could mobilize the increased muscular power that trance enables him to access. In fact, one of our state legislators in our state, I was teaching him how to use hypnosis because of a weight problem, worse than mine. He needed it badly. And he came to the office, and I was describing this to him in the orientation. I said, you'll be alert and conscious, et cetera, et cetera. And he said, Doc, I wouldn't have believed that. He said, I've recently had an experience in Las Vegas that taught me that you're telling me the truth. He'd gone to Vegas, they asked for volunteers on the stage, a stage hypnotist. He went trotting up there, and they did that. They hung him between two chairs from the nape of his neck to his heels. Two people sat on him. He said, I knew I was there. I knew I was doing it. I can hear the oohs and the ahs in the audience. I knew I was the hot shot. He said, I don't know how the hell I was doing it, but I really enjoyed it. And he said, this is what you mean. I said, yeah, that's what I mean.
Are stage shows with hypnosis big in your countries? They're dying out in the States, I think, because of lawsuits, partially. But that used to be something pretty common that we would see in a stage show, would be the hypnotic routine where they would do that. So obviously there's proof that the altered state doesn't always go with relaxation. Most of the clients, though, I think that come to our office are looking for the relaxed feeling as well as what they gain from the suggestion, because almost always they're dealing with anxiety-mediated or provoked or instigated symptoms. And so we often talk about it as relaxation, but I think that obviously some people don't. The other way we vary the routine, some people don't like the heavy feeling that they get with it, and they don't like to be told, as I just did in my generic thing, down and down, more and more relaxed. And so you can change it any way you want to. You can say things like feeling light and floaty and airy, and your hands are light, and the molecules of air don't even weight you down at all, or whatever you feel like saying. And so you can change it in whatever way makes the most sense for that particular client. It's probably also one of the reasons why we don't use tapes very often in our practice. One, because we think you need to vary the routine with each person, so it meets their individual needs. Two, because tapes are very seductive. They're very easy to listen to, they're very easy to learn with, but there are lots of times when you'd want to use the relaxation and it's not appropriate to have a tape. And so it's harder then for them to recreate it if they've only listened to a tape. And also the learning theorists have told us forever that listening to tapes is more passive learning, while is actually doing it is active learning, and that active learning is much better than passive learning. also, again, in our country, there are some unscrupulous people who will play a tape. They sort of indicate to the patient that they have, they're watching them through a two-way mirror, and they'll run like 6 rooms at a time, and they're not even in the building, they're just playing a tape to everybody. So they're making lots of money, and that's happened in the city where we live, actually, and so we're all very hyper-conscious about not using tapes for that reason.
I have a lady right now that I'm treating. She had a mediastinal tumor, and they had me come to a hospital and consult because she was not tolerating her chemotherapy well at all, and they were certain she was going to die unless she did. Well, she learned hypnosis well, a very bright lady who learned it quickly, but instead of feeling like she was subdued or going down, she felt like she'd like to go soaring, and so whenever I induce the state now, we soar like an eagle, and we wheel, and we dive, and we do all kinds of delightful things like that. We leave our troubles way behind us down on the earth while we're up here doing our thing. And you can alter these perceptions that they want, depending on what the patient wants and needs, and you have to kind of keep your ear attuned to that, I think, to do what is best for that individual. Are we ready for a break? We're ready for a break.
It's hot.
Include a lot of phrases that are quite easily understood by adults, but which can also be understood by children. For instance, you say you're going to feel very, very good, or very, very rested, very, very easy. These are all terms that little children know. The reason we do it in a generic manner is because then we don't have to adapt our delivery to each age group or each individual that we use. So the generic trance covers all, and people select from that what they want to listen to. People do that all the time anyway, but things that are inappropriate for someone who doesn't understand the age, for instance. If you say you're going to feel ultimately relaxed, the child doesn't know what you're talking about, but doesn't need to know what you're talking about. If you say you're going to feel ultimately relaxed in a rhythmical manner, then it's still part of the trance routine. There are no phrases that are age-specific, like very, very good, very, very rested, very, very easy, etc., etc. So you don't have to have a special parlance for every age group you deal with. We have the good fortune to have a little guy with us today, a little girl with us today. Guy is in generic here, and her dad is going to hold her, and we'll get a chance to observe what the child does, if anything, during the time that I am in Tony.
And anyway, you'll get to see how we might work with the child in our office. Obviously, this setting is very distracting, and may not be as conducive as one would hope to an office where there's only 2 people, but at least you can.
Yeah, if I notice any of the things that I mentioned to you in the little girl, I'll call your attention to it. If you want to kind of keep your eyes on her as well, you might pick something up too. Sometimes you'll see the eyelid flutter, for instance, will occur in children. They're pretty distractible. They also they don't keep their eyes closed. Even older children, when you tell them to close their eyes, they think that's a great game, and so as soon as you're into it, they go, look around to see what the hell's going on. So they are very entertaining to do. Children between the ages of 7 and 12 are the most suggestible people we have in the world. This was discovered or proclaimed 150 years ago by a Frenchman named Lebeau, not Lebeau, Lebeau. And he said that
No relation.
clinically, his judgment was that these kids were the most suggestive. We still feel that way. I think psychologists in our country now say 9 to 12, which is not much of a difference. It doesn't take anything very unusual to elucidate in such a child. We'll get him water, or get her water here. Then we'll proceed.
You want to sit down?
I was rather tired. So what I'm going to do is do just what we do in the office. I'm going to talk to you. What's that? Okay. Are you listening to me?
She's looking at me.
You're looking to me. Okay, I want you to listen to the sound of my voice as I go da 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 da. Listening only to the sound of my voice as you hear me say nothing at all. As I am saying nothing at all, you're looking at me and I'm looking at you. We're both having fun as we go on and on and on and on to a deeper and deeper state of total relaxation. Going on down into a deeper and deeper state of total and complete relaxation. Feeling very good in every way, very good in every way, and very, very rested. Very, very rested. Very, very rested. Down, 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 down to a deeper and deeper state of total relaxation. A total and complete relaxation. He's very good. Very, very good. Very, very good. Deeper, 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 deeper. Down, 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 down. Feeling very good in every way and very, very deeply relaxed. Very good in every way and very, very deeply relaxed. Feeling very good in every way and very, very deeply relaxed. Very good in every way and very, very deeply relaxed. Slipping along in a very deep state of total relaxation. Going down and down and down and down into a deeper and deeper state of total and complete relaxation. Down and down, 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 deeper and deeper and deeper and deeper, down and down and down and down, letting yourself descend into a deep state of total relaxation, feeling very, very easy, very, very pleasant, very good in every way, very, very deeply relaxed, 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 slipping along in a very easy state of total relaxation, very easy, very sleepy, down, 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 deeper and deeper and deeper and deeper, letting yourself descend into a deeper and deeper state of total relaxation, a deeper and deeper state of total and complete relaxation, getting very, very sleepy, very, very easy, very good in every way, and very, very deeply relaxed, very, very deeply relaxed, thinking of it, eyes are heavy, feeling very, very easy, very, very pleasant, very good in every way, and very, very deeply relaxed, very, very deeply relaxed, listening only to the sound of my voice and getting very, very deeply relaxed, down, 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 down into a deeper and deeper state of total relaxation, down,